I think one of the most important changes in patient care that has occurred at Urology Centers of Alabama in the last few years has been that our group has embraced subspecialization within urology. In other words, we have certain of our physicians who have a real interest and a real skill at treating certain specific diseases. Those physicians will concentrate on those areas and do work only in those areas. And what happens is those physicians become the very best that they can be in treating those diseases. Here at Urology Centers, we believe in this model. That's the model that's made Mayo Clinic and Cleveland Clinic great and world known. We believe at Urology Centers we can offer care that's just as good and maybe in some ways even better. When you come to see a physician at Urology Centers, you'll know that that physician has a true interest in your care and, more importantly, a real interest and a real passion to treat that specific disease or that specific condition that you have. Subspecialization within any medical practice will yield better patient outcomes, a happier patient, and a more content physician. We've certainly embraced this here at Urology Centers, as I've said, and I think it makes a real difference. My area of subspecialization in urology is the treatment of male sexual dysfunction or erectile dysfunction, the treatment of Peyronie's disease, which is curvature of the penis with an erection, and also the treatment of male urinary incontinence. These issues, while they're never life-threatening, certainly have a significant impact on a patient's quality of life. And I've found one of the great joys that I have in my practice is addressing these issues. Because if you can improve the quality of a patient's life, and specifically for me and my patients, the quality of a man's life, then you've done a great service to that patient. I may not save a life, but I can certainly make their lives a lot better. Erectile dysfunction is very common. We treat erectile dysfunction both surgically and non-surgically, and my surgical practice for the treatment of erectile dysfunction is the largest in the state of Alabama and actually one of the largest within the Southeast in the entire United States. My experience in the treatment of male urinary incontinence is certainly one of the largest in the United States and internationally as well. The treatment of urinary incontinence can truly make a difference in a man's life. Men who have been treated for prostate cancer and have urinary difficulties or leakage of urine come to us, and we know that we can help those men. So for men with erectile dysfunction or men with urinary incontinence, we want them to come in so that I can see them, that I can evaluate them, that I can address them with respect and compassion and try to make their life better. The staff here at Urology Centers, the nurses, the secretaries, and the ancillary staff are top-notch. They're high-quality individuals who truly care about the patient. While I truly enjoy taking care of patients, one of my real passions in urology is physician and surgeon education. I'm called upon to conduct courses and classes and teach the surgical techniques that I use to take care of men who have erectile dysfunction or urinary incontinence. I've been fortunate enough to have been asked throughout the United States and also internationally to teach these techniques. I've traveled to Australia, to Europe, and to Canada, and I truly enjoy working with other physicians and helping them to learn and to understand that for these men who have incontinence or who have erectile dysfunction, we can certainly help them and restore the quality of life to these patients. Outside the office, I enjoy the outdoors. I like to cycle, I like to run, I like to swim. One of my hobbies is competing in triathlons, although if I had to earn a living in triathlons, I'd be a pretty hungry fella, but I do enjoy the sport. Each year, here at Urology Centers, we sponsor an event called the Tour de Blue, which is an organized bicycle ride to raise money for prostate cancer awareness, and the money that we raise is used to fund free prostate cancer screenings. Prostate cancer is certainly an important healthcare issue in the United States and also around the world. And I'm able to combine my joy of cycling with my joy in caring for patients with the Tour de Blue. We have men and women come out from all over the state and actually from all over the Southeast to participate in the Tour de Blue. And all the money that we raise goes to help support the care and the treatment of men with prostate cancer. We're very proud of that. Treating patients who have urinary incontinence or erectile dysfunction can help restore the quality of their life. For instance, this morning I was actually out riding my bike and I came across a patient of mine who I operated upon about 6 months ago to treat his urinary incontinence. He was out running this morning. I actually saw him, I stopped to speak to him, and he actually gave me a hug and was nearly in tears because he's no longer leaking urine. He's able to compete in triathlons again, which had been a passion of his for many years, but he couldn't do that because of his leakage issues. But now he's been cured and he's back living the quality of life that gives him so much pleasure. What more can I say?